In February 2025, a team from Yale University dropped a fascinating piece of research into the world of science, a preprint paper on chronic illnesses after COVID-19 vaccination. This study looks at a condition called Post-Vaccination Syndrome, PVS, where some people experience persistent symptoms, such as fatigue and brain fog, after receiving the COVID-19 vaccine. The Yale University researchers raised newfound interest on PVS in their recent paper, Immunological and Antigenic Signatures Associated with Chronic Illnesses After COVID-19 Vaccination. They set up a study that emerged from the LISTEN project at Yale. LISTEN stands for Listen to Immune, Symptom, and Treatment Experiences Now, and the project was designed to study chronic illness following infection and vaccination with COVID-19. It is linked to Hugo Health, so people from all over the USA can take part. Participants were enrolled in 2 cohorts. The PVS cohort consisted of a total of 42 participants, including 29 women and 13 men, all with persistent symptoms after vaccination, while the control cohort consisted of 22 participants, including 13 women and 9 men, who all felt well and had no chronic complaints. They also divided both groups into those who'd had COVID-19 before and those who hadn't, based on self-reports and antibody tests. The participants gave details about their health, symptoms, and which vaccine they had received, including Pfizer, Moderna, or Johnson & Johnson. Then the research team gave all the participants a blood test to look for immune cells, antibodies, and even traces of the COVID-19 spike protein. They compared the immune systems of the PVS group with those of the healthy controls, looking for clues to what was going wrong. The results were quite impressive. The types of vaccines reported were 14 from Pfizer's Comirnaty, 21 from Moderna's Spikevax, and 4 from Johnson & Johnson's J-Covden. The most common symptoms reported by participants were excessive fatigue, 85%, tingling and numbness, 80%, exercise intolerance, 80%, and numbness, 80%, exercise intolerance, 80%, brain fog, 77.5%, difficulty concentrating or focusing, 72.5%, difficulty falling asleep or staying asleep, 70%, neuropathy, 70%, muscle pain, 70%, anxiety, 65%, tinnitus, 60%, and burning sensations, 57.5%. So should you be worried? It depends on how you feel. COVID-19 vaccines have saved countless lives and the risk of serious illness from the virus. But for the few who experience PVS, it's not trivial. It is also important for those who have suffered acute adverse events such as myocarditis and pericarditis, thrombosis and thrombocytopenia, Guillain-Barré syndrome, transverse myelitis, and Bell's palsy. The paper was published on Medrxiv. The author, Professor Akiko Iwasaki, and her colleagues believe that it underscores the need for further research to validate and address this condition, balancing the benefits of the vaccine against its risks. As the paper is still a preprint, it still needs to be thoroughly reviewed by other scientists to confirm the findings. In the future, the researchers may investigate: why does the spike protein persist in some people? Can we predict who's at risk of PVS before they're vaccinated? Could treatments reset the immune system in people with PVS? For now, if you're curious or concerned, talk to your doctor. The CDC website is also a good place to get the latest information on vaccine safety. Okay, if you found this video helpful, be sure to like, subscribe, and turn on notifications so you won't miss our upcoming videos. Leave your comments below. We'd love to hear from you and continue the conversation. Thanks for watching, and we'll see you next time.